Thank you all for being here. I'd like to let you know that this is being recorded. It will be on the NAMI Yavapai YouTube channel. And if you don't want to have your comments on the recording, you can put them in chat, and that's how that will work. So our format is we have two presenters today. The topic is human trafficking, learning the signs, what it is and isn't, and how you can help those involved. I would, before I introduce our presenters, I'd like to ask them, would you like to take questions during the presentation or have people wait until afterwards?
I'm good with either. That works for me. If we do it during, you'll have to let me know because I usually can't see like people raising their hands while the presentation's playing.
Okay. All
Same
right.
here. Yeah.
Okay, so if you have a question that you want to put in chat, or if you'd like to raise a question during the presentation, then raise your hand and I'll interrupt the presenters and bring you in with your question. So with all that said, I would like to introduce Michelle Rucker. Michelle, if you'd like to raise your hand to everybody there. If you are not speaking, please do put yourself on mute. Michelle is the Director of Human Trafficking Services at Northland Family Help Center and the chair of the Regional Anti-Trafficking Coalition, the Flagstaff Initiative Against Trafficking. Previously, she was the Anti-Trafficking Program Director at the Attorney General's Office in Arizona for 8 years, where she conducted state and national trainings and crafted policy recommendations to benefit survivors and increase investment for anti-trafficking initiatives. Following that position, she was recruited to serve as director of Cities Empowered Against Sexual Exploitation, Arizona, where she worked closely with the city of Flagstaff on human trafficking training for law enforcement, first responders, and municipal staff. She's been instrumental in advocating for increased enforcement activities to recover victims, help them out of the life safely, to get out of that life safely, and hold offenders accountable. She currently holds a Master's of Public Administration with the concentration in gender-based violence from the University of Colorado, Denver. So welcome, Michelle. We are so happy to have you here. Next, I'd like to introduce Savannah Sanders, who I had the honor of meeting in person at a conference in Prescott a few weeks ago, where she presented. Savannah is the executive director and co-founder of Applejack's Ranch, using unique perspectives of lived experience and 15 years in the field to inform policies and practices around the world. Savannah is celebrated for her heart-led leadership and her unwavering dedication to prevention work. In her career, she has also played key roles in several prestigious organizations dedicated to social justice and community empowerment, including Survivor Alliance, Sojourner Center, the Sandra Day O'Connor Institute. Her expertise and leadership have been instrumental in advancing causes of these organizations and in mentoring the next generation of advocates and leaders. In 2015, she graduated from the Arizona State University with a bachelor's degree in social work. Let me see here. And published her book on sex trafficking prevention, a trauma-informed approach for parents and professionals, which is used as a tool for many nonprofit and educational organizations addressing trafficking. So with that said, I will let the two of you take the lead.
Thank you so much. All right, I'm going to share my screen and hopefully not mess any technology up in the process. Oh, I need permission to be able to.
Will, can you make that happen, please?
Okay.
Will, do you need to make her a co-host to let her share her screen?
I have it now.
Okay. And I want to thank Will for his technical assistance on all of this. Much appreciated.
Okay. All right. Okay. So as my name's Savannah Sanders, as you know, and I'm the executive director for Apple Jacks Ranch. And we are committed to cultivating communities of healing and connection for individuals who have experienced abuse or exploitation. We are a lived experience organization, and we focus on education, advocacy, and direct services to reduce and mitigate the risk factors that lead to trafficking and exploitation. We believe in addressing the root causes such as homelessness, sexual abuse, system involvement, and inequality, and making sure that our services are flexible, and that our services and spaces are flexible, meeting the needs of the individuals we have the honor of serving. We truly believe in transformational relationships where we can all heal together in community. And we believe in the freedom of choice, and that all people, including young people, are the experts in their individual journeys. We're based in Yavapai County right now. We also work in other rural communities as needed. And we were able to get a grant through OVC to be able to provide direct services in Yavapai County for the prevention of trafficking of teen girls. And that's really driving our service provisions in Yavapai County right now, and we're expanding to other areas.
All right. And like like she had mentioned, my name is Michelle Rucker, and I really wear two hats. So I'm currently the Director of Human Trafficking Services at Northland Family Help Center in Flagstaff, Arizona. And I'm also the chair of our regional coalition, which is the Flagstaff Initiative Against Trafficking. So those two roles are, I mean, very different. First and foremost, the coalition is really trying to get us on the map as a region to effectively respond and ultimately prevent exploitation crimes from occurring in the North. So Fiat as a coalition was founded back in 2017, and is really community driven. So we have organizations, service providers, community members, law enforcement, really every sector from the beginning has been involved in this coalition, because we recognize that everybody has a role to play in addressing exploitation and making sure that we're preventing it in our region. So the coalition is currently based out of Northland Family Help Center, where I work. And the reason for that is that Northland is currently the only gender inclusive shelter for human trafficking victims in the Flagstaff area. And we do tend to serve a lot of folks from neighboring regions in the north as well. So right now we have a 24-bed sexual and domestic violence shelter, as well as a 15-bed youth shelter. We were able to also provide free counseling, trauma therapy, and legal advocacy to any of the folks who are staying with us in shelter. Really, you know, as we'll get into, when it comes to juvenile trafficking victims, one of the really important partnerships that we have at Northland is with our juvenile court system. So we do have youth who are in detention, who are currently released on probation, who actually will come to Northland as as a step down from being in detention, really giving them a soft landing place while we figure out what that more long-term placement's going to be. I mean, just really surrounding them with the supports needed to reintegrate back into their previous life. So we, of course, serve youth and adults, victims of human trafficking, domestic violence, and sexual assault. And as I'm sure you can imagine, we do see a nexus between all of those crimes. And we also operate the regional crisis line in partnership with Northern Arizona Care and Services After Assault. So we will take calls 24/7 from the community folks who are experiencing domestic violence, sexual violence, or trafficking, any type of exploitation. And that's a really important piece for Northland, is we're able to really get a good grip on the data and what folks are experiencing in our region via the reports made to that crisis line. Go to the next slide. So when Fiat was founded, the community came together and constructed the 3 goals that you see on the screen. So first and foremost, we wanted to construct a unified response for trafficking victims and survivors to help them get out of life safely. In our region, in Flagstaff and Northern Arizona, we're about, I would say, 10 or 15 years really behind some of the other parts of the state when I'm talking about major metropolitan regions like Phoenix and their surrounding suburbs. So we honestly really have a lot of work to do. So we're kind of in the infancy of getting that work really done. And just making sure that everybody in our community knows exactly what to do if we do have somebody who makes a disclosure, and making sure that we're putting those proper supports in place. And of course, as Savannah had mentioned, prioritizing choice and freedom and making sure that that person has a say in what is going to happen from there. In order to have that unified response, we really work to make sure that every organization and service provider is equipped with the tools to effectively respond, which could include screening tools, questions, training is a big piece of that, in addition to education on our community response protocols that we developed. Second is education and training. So training, without that, we don't have a unified response. Without training, we don't have service providers who are effectively treating survivors with the dignity and respect that they deserve and getting them the resources they need. So that's a big chunk of how we spend our time, is just making sure that everybody's operating from the same framework of information. And we don't want folks thinking that trafficking is something that happens in movies and television. It happens right here in our community, and it's going to look a lot different than it's going to look in the Phoenix area. And then finally, we collect data. So Flagstaff, the Flagstaff Area Human Trafficking Database, we have been running that since September of 2018. And it's really the only community-driven database I'm aware of in our whole state where we will actually have voluntary participation from organizations who really have to adhere to a very specific set of criteria before they're able to include individual or client that they're serving as a suspected or confirmed victim of trafficking. And so we're able to actually present numbers from our region, which is very, very rare. You'll find that we're not going to have a lot of stats that speak to prevalence in this presentation. If anybody tells you that they know how many victims exactly they have in their region or how many folks are trafficked every year in the US, they're lying to you. There's really no way for us to quantify that yet. But what we can do is give a rough picture of what we see in our area, just to kind of drive the decisions that we make and the interventions that we prioritize. Next slide.
All right, well, I don't feel like we need to go over our introductions because we've done that significantly so far. All right.
Yeah, so just to give you a background into what trafficking is, because there still is so much misinformation, I wanted to go over the basic definitions just to get us started. So the definitions that you see on the screen that we're going to talk about today, all of that comes from the federal law, which is the Trafficking Victims Protection Act. So this was only passed in 2000, so it'll be 24 years this October. So when we're thinking about this issue, we're really, in the infancy of beginning to address it. 24 years is not a long time. We've had well over 50 years of addressing the issue of domestic violence, and we still haven't solved that. So if that tells you anything, we have a long way to go. So human trafficking is an exploitation-based crime in which traffickers utilize elements of force, fraud, or coercion to control victims. So when you hear the term human trafficking, it's really not all that specific of that person's experience. And again, every person's going to have their own unique experience of exploitation. Really, there are 2 types, sex trafficking as well as labor trafficking. And really, it's very common as well for us to see folks who have experienced sex trafficking simultaneously or at another point in time also experience labor trafficking and vice versa. So we'll be able to show that to you in the data as well. On the next slide. So the definitions, again, coming from the Trafficking Victims Protection Act, as well as our state law here in Arizona, labor trafficking is when we have force, fraud, or coercion used to recruit, harbor, transport, obtain, or employ a person for labor or services. Easiest way to think about this, outside of all of that jargon, is unpaid labor, underpaid labor, labor that's done in unsafe working conditions, labor that's not what was originally promised to that individual. So we do see labor trafficking happening in our state. However, really only in the last couple of years has there really been a concerted effort to focus on labor exploitation. Probably the largest case in Savannah, you can correct me if you know of another one, but the most infamous case actually came out of Flagstaff, Arizona, with the I Do Bridal Boutique. So anybody that's been to Flagstaff, you have definitely seen this building when you're driving down Route 66. Essentially what the situation that happened there is they had the business owners of the boutique who brought several women from a country in Southeast Asia, had told them that if they came to the United States, they would be able to get married and have citizenship in the US. And then that was a lie. Essentially, they were brought here and they were forced to work, sleep, live in the basement of the boutique. And unfortunately, we did find that even though those individuals face criminal charges, we weren't able at that time to meet the threshold of a labor trafficking crime in court. So they got charged with a lesser crime, even though what they were doing technically constituted labor trafficking. But our training wasn't there yet for our criminal justice system, so they got a lesser charge. And interestingly enough, the owners of that business who are confirmed to have labor trafficked these folks now own that building once again and are currently operating the boutique in that same building. When it comes to profiles of victims with labor trafficking, we're going to see more so individuals who are coming from other countries who would be considered either undocumented or foreign nationals. Whereas with sex trafficking, the population is very different. With sex trafficking, this is when we have a commercial sex act that's induced by force, fraud, or coercion, or in which the person performing the act is under the age of 18. So to really break this down, you have to know what a commercial sex act is, and we also, of course, have to unpack force, fraud, and coercion. So a commercial sex act is any sex act at all done in exchange for something of value. So again, it could be a sex act done in exchange for cash, or it could be a sex act done in exchange for a sandwich, a place to stay tonight. Really, whatever it happens to be, it could be a sex act done in exchange for drugs. The key here is that we have a transaction occurring. That's what's going to differentiate a commercial sex act from other types of abuse. Now, moving forward, when we have adults, we have to have elements of force, fraud, or coercion to prove that a sex trafficking crime has occurred in the court of law. When we have juveniles or people under the ages of 18, if somebody who's 17 years of age or younger engages in a commercial sex act under the age of the law, they're considered a sex trafficking victim automatically, full stop. It's really important to understand that a child can never consent to commercial sex. So when we still have folks saying in their reporting that the child was a prostitute or the child is prostituting themselves or engaging in acts of prostitution, not only are they out of alignment with the law, but they are completely out of alignment with the culpability and the consent ability of that child. A child cannot consent to commercial sex, and nor can they be a prostitute. And of course, as we'll get into, we have co-occurring intimate partner violence, sexual assault, and strangulation that does also occur alongside trafficking crimes. Next.
So when we think about trafficking, we want to make sure that, again, we're not talking about child prostitution. There's no such thing as child prostitution. And as Michelle was saying, it's anytime, a lot of times youth will be considered child prostitutes, or they will use the term survival sex. And again, there does not have to be a trafficker involved in order for there to be trafficking and exploitation with somebody that's under the age of 18. And labor trafficking also happens amongst youth as well. This isn't just something that happens to people over the age of 18 or in certain settings. This can happen in a lot of different situations. And the reason that we focus on both sex and labor trafficking is because there's a lot of the same risk factors. Labor trafficking survivors have a lot of history of sexual abuse and physical violence that has happened during their experiences. Sexual abuse is rampant in those areas, and both forms of trafficking heighten the other one. So if we're not addressing labor trafficking, we're also not addressing trafficking and vice versa. The other thing that we want to think about too is there's a lot of information in the media that shows who traffickers are. There's lots of movies and all sorts of different things where it's one, gang related or a pimp or something like that. But one of the things that's really prominent, especially in rural communities, is going to be familial trafficking. We have a much higher percentage of familial trafficking happening within our rural communities. And that's where we're going to not be seeing these traditional like red flags and people that are hanging out in certain areas, because this is going to be stuff that's happening underground within our community, within people's homes. It might be due to poverty. It might be due to substance use. There's a lot of different factors that play into familial trafficking. Trafficking can happen in intimate partner relationships. And then also people trading sex with minors can be perpetrating trafficking without there being a trafficker, as we've said. And then there's the traditional stuff that you guys might see in the media or in movies too, which does exist. So it's not that it doesn't exist, it's one portion of what we're looking at. In a more urban setting, there's going to be more gang-related trafficking. There's still a lot of familial trafficking happening in our urban settings, but in rural communities, we're going to see the highest amount of familial trafficking, and also online stuff, making transactions online, inviting people to hotels. All of that stuff is still going to be happening in our rural communities. So we need to look at the whole picture.
So just to give you a little snapshot of what we see in the northern region, I wanted to share some of the recent statistics from the Flagstaff Area Human Trafficking Database. So again, this is taken from September of 2018 until now. So today we've been able to identify 427 adult victims who have been served by participating organizations in our community. And those organizations are listed at the bottom of the screen. So of course we have Northland Family Help Center. We also have some of our human service providers like Catholic Charities, Flagstaff Shelter Services, as well as Sharon Manor. So that being said, it's really important to also understand the connection between homelessness and trafficking. There's a recent study that I saw that said that about 65% of folks who experienced sex trafficking, their first experience of exploitation was when they were facing housing instability. So that piece is huge, and that's why, of course, we're able to generate this level of identification just with these 4 providers alone. So again, 427 unique adults since September of 2018. And regarding victimization type, we were able to see that about 55.7% reported experiencing sex trafficking, 23% labor trafficking, 16.7% both sex and labor trafficking. Again, these are often going to be co-occurring. And then we had an additional 4.5% who said that they did experience trafficking, but they did not wish to disclose whether it was sex, labor, or both sex and labor. The next slide. So when it comes to gender identity, it probably comes as no surprise. Most of the time when we're talking about trafficking, people tend to think that we only have female identified individuals who experience exploitation. So we have, again, 78.5% of females who have been identified within our database. But I think it's really important to understand that we're looking at some of these other categories as well. 20% male. As well as disproportionate representation of folks who identify as genderqueer, non-binary, and transgender. And I can say these figures are in alignment with what we see in other parts of the state as well. So other data that's collected in other regions like Maricopa and Pima counties is going to point to about that 20% male as well. And then again, disproportionate representation of folks who identify as genderqueer, non-binary, and transgender. You probably have noticed that we only have adult victims who are included in the database to date. One of the reasons why is it's very difficult because of confidentiality, to get juvenile data. But that is a huge push and a big goal for Fiat right now, is getting all of our providers who are currently serving juveniles to actually start inputting that data into the database so we can get a better picture of how many juveniles are also experiencing exploitation. And just to give you kind of a general sense, about 100 adult victims a year. This is probably around what you would probably see if there was a database being utilized within the Maricopa County area. And that's not necessarily to shock anybody at all. This is a very underground crime, and honestly, the data is not perfect. As I said before, if somebody tells you exactly how many folks they have in their community, they're lying to you. So this is really our best guess at this point. And one of our main priorities is continuing to make sure that our data gathering is legitimate, and that we have very good practices in place for all of our providers who are inputting this data, so that we're not over counting how many folks are experiencing exploitation in our community. Next slide.
Is it still showing the screen?
It minimized, but yeah, we can see it. It's just really small.
Sorry, I'm having issues with it. Okay. So we want to ask you guys, what are the risk factors that you might see in your community? So think about the populations you work with. What are risk factors you see that could lead to trafficking? And how is this compounded by the rural community? And you can put your answers in the chat or raise your hand.
And Savannah, we did have a comment in the chat. You can either take that or I can take that, from Tammy.
Oh, yeah. Thank you, Tammy, for your comment. It says that it's really interesting that 0.5% of genderqueer is sex trafficked. As a mom of a queer child, that has been a huge fear of mine, and I thought this number was bigger. It probably is bigger, a lot bigger. These are the stats that we currently have, and again, anytime that we're having intersectionality of any aspect of this, anything that leaves people vulnerable to trafficking in the first place is going to compound the opportunities for identification and understanding, right? So depending on their population, their location, all of that kind of stuff is going to impact it. Queer youth are at really high risk of exploitation for a lot of different reasons. And one of those reasons is because of homelessness and runaway that compounds those aspects, especially when youth are kicked out of their homes for whatever reason due to their sexual identity or their gender identity. And then it's compounded by them needing a place to stay. Okay, yes, thank you for all of those. Michelle, I'm so sorry, but the presentation won't play on my end without there being some technical difficulties. I'm going to close it out and let you share screen. Okay.
yeah, if I could just get permission, I can do that. No problem. Mm-mm-mm.
All right, thank you. Okay, next slide. So we have a lot of different risk factors that lead to trafficking, and these are the populations that we're going to be working with in our community in a lot of different ways. Sexual abuse is a huge precursor to trafficking because of the risk factors that are and the vulnerabilities that come from sexual abuse, poverty, generational trauma, domestic violence, being unhoused or running away, inequality, the LGBTQ community, disabilities, and system involvement are all huge risk factors into trafficking. Next slide. And we're going to go over more of that. So childhood sexual abuse is the strongest predictor of human trafficking. And one of the reasons that we're focused on Yavapai County is because Yavapai County has a much higher sexual abuse rate than the rest of the state. The Department of Child Safety reported that 12% of substantiated maltreatment reports for children ages birth to 17 was 6% higher than the average overall state. Now, these are only cases that are being identified, and with sexual abuse cases, that's the same with trafficking. Like sexual abuse is very underreported, it's very underinvestigated. And a lot of that comes from lack of information or understanding, and also those different familial pieces. And there's a lot of reasons why a child might be afraid to disclose their childhood sexual abuse or their sexual exploitation, especially when family members and people in their community are involved. Next slide. So as I was saying, LGBTQ identified individuals are disproportionately higher rates of trafficking because of the lack of home and stability for a lot of youth, and discrimination increases barriers to employment, especially for people who might be trans that are looking for work but don't necessarily pass, don't have are discriminated in work environments, which leads them to not having any kind of work opportunities, that leads to homelessness, and not having a choice in engaging in sex for pay in all sorts of different ways. Next slide.
All right. So again, you can tell that even though we don't have great data, I still love data nonetheless. So I'm going to present a little bit more of that to you. So all of the information that you see on the screen is taken from a study that's done annually by the Arizona State University Office of Sex Trafficking Intervention Research. So every year they do a survey of homeless young adults in Maricopa and Pima counties, age 18 to 25. And really try to understand their experiences with regard to exploitation. So this is data from the most recent survey that they conducted last year. And of the 89 folks that they were able to survey, they were able to find about 23% of those folks experience sex trafficking, either historically or currently. And then an additional 40%, or I should say 40% included individuals who experience one form of exploitation, either sex or labor. And when we're breaking down some of the demographic information, I think it's really telling, and really validates also what we're seeing in the Flagstaff and Northern Arizona region. So when it comes to sex trafficking, they found about 66.7% identified as female, and again, 19% as male. So we're really hitting that roughly 20% male identified population. I've seen other research that's done from other parts of the country that, puts male identified individuals between 20 and 35%. So again, it's not perfect. It's right now at this point our best guess. We also see disproportionate representation from folks who identify as genderqueer, two-spirit, or transgender. When it comes to ethnicity, from these two counties, we see about 38.1% Caucasian, so the majority, and 33.3% Hispanic. And then disproportionate representation from folks who identify as biracial, African American, and American Indian. And I will say at Northland, we do see very high disproportionate representation of folks who identify as American Indian who experience domestic violence, sexual violence, as well as trafficking crimes. When it comes to labor trafficking, I think this is really, interesting. So you can kind of see the difference, at least in the populations that we're currently identifying. When it comes to gender identity, we see a more even split between male and female identified individuals. So about 47% of folks identifying as female who experience labor exploitation and 38.1% identifying as male. And again, with all of these, we're going to see disproportionate representation from folks who identify as LGBTQIA. And when it comes to ethnicity, again, that's when we see a huge flip. So over here, we see the vast majority of folks experiencing labor exploitation identifying as Hispanic at 42.9%, 23.8% Caucasian, and again, disproportionate representation from folks who identify as biracial, African American, and African Caribbean. So taken from the same study, really what we want to do is really understand the experiences that these folks have faced and what their life histories are like. So from the research that's been done, and of course, in hearing from survivor leaders as well, we know what a lot of the major risk factors are going to be for sex and labor exploitation, which I've listed here on the left-hand side. So housing instability is huge, as we've mentioned. History of child trauma and sexual abuse, some identifying as LGBTQIA. Involvement in child welfare, poverty, the economic issue is huge, goes right alongside housing instability. And really, the best way to look at this, I believe, is through the lens of adverse childhood experiences. So that's like a big buzzword, right? We all know about ACEs now. So within this survey, with the folks that they identified, they actually administered an ACEs questionnaire. So for those who are not aware what an adverse childhood experience is, I did list in this blue box what constitutes a adverse childhood experience. So essentially we're talking about any adverse experience in the vein of types of abuse, neglect, mental illness in the household, having an incarcerated household member, substance abuse, things like that, witnessing domestic violence. And, when we have these things happening before a person's 18th birthday, they're given a point. And that's where we really are able to develop their ACE score. So for every one of these things that they've experienced before they turn 18, they get a point. So moving over to the chart that I have on the screen on the right-hand side. So when we're looking at average childhood experiences, we're going to look at the sex trafficked group versus the non-sex trafficked group. When we look at, line number 1, the individuals who have 4 or more ACEs, we're going to see 71% of the sex trafficked group having 4 or more ACEs. When we look over at the non-sex trafficked group, that number in percentage drops to 45%. Looking at sexual abuse, this is one that, Savannah's talked about a ton. Myself as well. Sex trafficked group experienced sexual abuse as a child at 42.9%. Non-sex trafficked group, we're looking at way lower at 14.7%. Looking at sexual abuse as a child being 12 and under, again, 42.9% for the sex trafficked group and only 14.7% for the non-sex trafficked group. And those figures remain pretty steady for the sexual abuse as an adolescent. And again, when we're looking at the number of ACEs, we see folks who have 4 or more ACEs being at about 52.8% of that group and 44.9% having between 0 and 3.
So when we're talking about increased vulnerability, and the thing that is really important for us to recognize when we're talking about these vulnerabilities is that these are experiences that youth are having, but these are also things that traffickers and abusers are looking out for. And that's why it's so important for us as the community to understand these risk factors, so that when we are mitigating these risk factors and stepping in and doing these services, we want to be able to build resiliency and support. And traffickers and abusers are looking for those vulnerabilities and are really, really well trained in it to be able to recognize when those vulnerabilities occur, and then using that as an introduction into exploitation. And then the population that we also want to make sure that we are talking about are youth with disabilities. And for a variety of different reasons, our prevention efforts need to look different with youth that have disabilities. We have all sorts of different interventions that we need to use. And recognizing that those vulnerabilities look different. For an example, I have a lot of teenagers, and one of my daughters is autistic, and her prevention and what I've had to do with her has looked very different than the rest of my kids because of the way that she socially interacts. We had to take our time with longer prevention efforts, such as like when she was able to start going to people's houses, and she's very trusting and loves everybody. So there's been a lot of different interventions that have, or not interventions, but preventions that have needed to take place with her versus my other kids. And these are things that need to be taken into consideration across the board. Next slide. So one of the things that we definitely want to touch on, and I don't have stats as far as a page goes, but we know that based on most of the information that we have, and again, it's very underreported, that almost 40% of trafficking cases, 30 to 40% are going to be familial trafficking cases. So it's really high. It's not like 10% or one of those lower numbers. This is a huge portion of the trafficking that's being identified, but also we have a lack of understanding of familial trafficking in a lot of areas. And so that's also impacting these stats, because this is also the form of trafficking that's the least amount of identified. So familial trafficking is a form of trafficking where family members exploit their relatives, often children, for labor or sex. And it's prevalent in impoverished rural communities. And one of the reasons that it can be very generational. So if your parents were trafficked and then your parents trafficked you, that can be a huge risk factor. It can be for substances, it could be for rent. I used to be on a mobile crisis team down in Florence, which is very rural, and we changed our intake forms to start identifying youth within the emergency room that were in there for crisis management and suicidal ideations, and we would come in and do the assessment. In a 3-month period, just by changing our intake form, we identified 7 youth that had experienced familial trafficking in that area. And the only point of contact was them coming into the emergency room. So that was 7 youth in 3 months. So imagine what that would be like if we were screening in the other various ways that we're providing services in rural communities. And a big part of this is we're not screening, and we try to silo out some of these services often. And if you are working with anybody that has a history of sexual abuse, homelessness, domestic violence, the likelihood of them having an experience of exploitation is incredibly high. It's just not being identified. And so what we need to do as a community is understand, when I identify this, does that mean that I need to like take them out of a DV shelter and put them in trafficking specific services, or what do we do? And it's really important to recognize that and I'll just use my own personal experiences, and I don't speak for all survivors in this, but for me, by the time I started getting services, I did not need services related to my trafficking, but identifying my trafficking experience helped with my recovery process, because then I was able to understand different types of trauma that I experienced. But by the time I was trafficked, I had experienced so much trauma prior to that, that was not the main thing that I needed to help. That's not what I didn't need trafficking services, right? So we as a community need to start screening and understanding the impacts of all of these different types of abuses, and making sure that this is included in what we're looking for and screening for, because it really does impact the person's service delivery and the opportunities for different resources and different ways to support. We have lots of different federal funding that's coming down the pipeline. And so helping understand what all of those resources are going to be incredibly helpful. And when we're looking at prevention, it's very generational in two ways. As I was saying, there could be a family member that's trafficking another family member that traffics another family member. And then also, just because of the generational cycles of poverty and intimate partner violence, that can also lead to very high risk factors. So like, for example, my grandmother was trafficked, my mom was trafficked, I was trafficked, my sister was trafficked, but nobody in our family was trafficking each other. And my kids were 10 times more likely to be trafficked because of my own experiences. And the only way that that was able to be prevented was me getting the services that I needed and being able to stop that with this generation by moving into a place of breaking all of these cycles of poverty and exploitation and sexual abuse, so that my kids didn't have those same experiences. Next slide. So think about where you might start. So one of the things that's so important for our rural communities, it especially, is because Michelle and I have talked about it a lot with like what the media representation is and what that could look like. And we want to really shift from this sensationalized trauma, like all of this trauma information. Like, we don't need to know like the very explicit details of what people's experiences were, how many broken bones they had, what experiences they had when they were trafficked. We want to really look at this from a public health framework and looking at how the community, the family systems, the culture, all of that impacts it, so that we can look at actual prevention and intervention and support people in their success. You want to know what trafficking looks like in Yavapai County, which we've gone over a lot today, and utilizing what exists. This does not mean that we need to create 15 different shelters with 100 different beds specifically for trafficking survivors. We need to have an array of services within the community that utilizes the strengths of these organizations that have already been doing work in the community for a long time, that have different standards of care, and then look at those policies and procedures and look at how we can implement trafficking into those, implement trafficking understanding into those organizations, and not feel like every time there's a trafficking survivor, we need to like send them out of the city. That's a big vulnerability that we have in rural communities, especially for youth that are system involved. If they're growing up in rural community, and that is actually one of the reasons I was trafficked. I grew up in a very small town. And then when I came to Phoenix, being from a small town, it left me much more vulnerable to trafficking experiences in Phoenix, because I was out of this small town rural environment, and then kind of naive to some stuff and then not naive to other things. But and then having that compound aspect of sexual abuse and child abuse and homelessness and all of the things that I was experiencing, all of those risk factors were what led to me being trafficked. So when we're looking at rural communities, we really want to focus on youth who have system involvement, that because we don't have enough services right now, youth are going into group homes and different services down in the valley, and then they're really at high risk of being exploited if they haven't already been exploited. So if they have a history of familial trafficking and then they move down to the valley, or moved down to the valley, then there's likelihood of there going to be more exploitation and different forms of exploitation happening in that urban setting. So, thank you. So think about what your current policies are, what your role in these policies are. So one of the things that we want to avoid when doing identification or disclosures is really understanding what your role in all of that is going to be, and understanding if it's your job to get this whole like history of this individual and understand every aspect of abuse, or is that something that you focus on with their therapist or an intensive case manager versus knowing that they experience trafficking does not mean that we all need to know like every detail of what that trafficking experience was for them. And then understand what your current referrals and resources are that you utilize when you make reports. So what are your child abuse, sexual assault, and domestic violence referral and resources? And when those reports are made, how can you add on to that to include trafficking instead of it being like this whole separate thing, but just incorporating it into what you're already doing? Because I guarantee you're already working with this population if you're working with people with histories of all of the things that we've talked about. And I'll just give a really quick example of what that looks like. So I was the director of a domestic violence shelter. Well, I was a director of human trafficking within a domestic violence shelter. And in 1 November, we had 2 referrals for trafficking come in. This was a 120 bed crisis shelter, so we had a lot of referrals on a rolling monthly basis. Those 2 referrals that we got were specifically referrals from other agencies who had already identified them as experiencing trafficking. When we changed our screening and started asking some of the right questions and changing some of our policies and procedures, in November, we had 2 people that we were serving that had been identified with trafficking. In December, it was over 30. And the only thing that changed was our policies and our screening, meaning that people that were coming in specifically for domestic violence and sexual assault that did not meet the red flags and the indicators and all of these things that we would be talking about, like tattoos and cell phones and dress, their clothing, and all of these kinds of things that people used to be looking specifically for trafficking, were not any of the things that were coming up with this population. It was actually that they had experienced domestic violence, sexual assault, and at some point in their life had also experienced sex or labor trafficking. It could have been for 2 months, it could have been for 18 years, but there weren't outward signs of what it was looking like. It was just the questions that we were asking. Next slide. So consider the challenges to identification. One, trafficking is one of the things that's really hard for people to self-identify with because of the moral injury and different things that occur within the context of these experiences. So since prostitution and addiction and all of these things are so stigmatized within our society, when you are having different trafficking experiences, you don't feel like you are being victimized, but you are engaging in bad behavior, that you're doing something wrong, and not that something's happening to you. It can also look like a lot of other abuses and not understanding the difference between those different things. There's a lot of impacts from PTSD and trauma bonding with the abusers. Lack of rapport. Traffickers are really good at training you and manipulating you into not making reports about anything, not saying anything, and very specifically like making you feel like if you call the police, you will go to jail, you're engaging in illegal activity, you're bad, they're the reason for all of this. Also, a lot of traffickers tend to use younger people as kind of their go-between for a lot of stuff. So putting young people in positions to where they're setting up hotel rooms, they've got their ID on things, they're doing different stuff for the trafficker so that if anything ever goes down, they're the ones that will take the fall. Lack of trust and a lot of misconceptions. Next slide.
So alongside what Savannah has been talking about, there are some really simple things that we're trying to work on in Flagstaff and Northern Arizona just to make sure that our service providers are best equipped. As I mentioned before, we're really behind a lot of the more metro regions of the state. And when we're talking about Flagstaff, it's interesting, right? You never really think of Flagstaff as being a rural community or being a community where there is economic inequality, but as really the region with like the absolute worst housing crisis throughout the state. I mean, we have folks who work in the region who can't afford to live in the region. Any place where you have those kinds of economic issues, where you have folks who have a lot, folks who have not a lot, and then not a lot of folks in between, that's when you see exploitation occurring. So yes, we are a college town, but yes, we are also situated in the second largest county in the entire country. We do have very rural regions, and a lot of the same issues that you would see in probably a more classical rural community that you would envision. So that being said, we need to make sure that all of our sectors have the tools that they need to just start the basic process of addressing trafficking. And that really is going to allow us to actually put in some really good prevention initiatives. So we're at the point where we need to learn what this even is, right? So first and foremost, we want all of our organizations who are members of our coalition to adopt the four elements of an organizational human trafficking response, and they're very, very simple. So we want folks to have profession-specific training for staff at all levels, and it has to be really, in my opinion, provided by local experts or lived experience experts. We need to have folks who actually know what this looks like, and especially what it looks like in our region, because again, it's going to look a lot different than what you're going to see in the Phoenix area. We want that training to be integrated into new hire onboarding. Oftentimes in this field, you will have organizations that say, oh yeah, we train all of our staff on trafficking. And I say, okay, you gave everyone a 1-hour training and it was 5 years ago. What have you done since then? What about all the employees? What about the very, unique nuances of trafficking? 1 hour doesn't cut it. This is something that has to be ongoing. We also want folks to undergo an annual training update. So again, we're having these conversations every year. It's going to be profession specific, and it's going to also integrate skills-based information. So we're trying to move beyond, again, just what is trafficking and get them to understand, in my specific profession, this is what I should be doing. And then, of course, providing ongoing professional development opportunities. So every FIAT meeting that we have them quarterly. You are all more than welcome to attend those. We include a training component. And there's so much to learn. And anyone who says that they know everything about this issue, again, at first blush, I laugh because there's so much and it changes all the time. So we really need to be ongoing learning what this looks like and how to respond. And of course, that prevention aspect is key. We want to implement trauma-informed screening questions and or formal validated screening tool where it's appropriate. Savannah talked about how beneficial that was in her work. We are seeing the same exact thing in our region. And we don't want to get to the place where, we're straight up asking folks, did you just have sex for money tonight? That's not trauma-informed. That's really not respectful either. And so what we want to do is make sure that we're using questions that are appropriate, that make folks feel comfortable, that are really going to get to the root of what is going on with that person so that we can get those services for them. Internal written human trafficking protocols. We often, and this happens in other regions of the state as well, get to the place where, oh my goodness, we have somebody who just says that they face exploitation, and then we panic and we put them in a car to Phoenix, right? that is often not going to be helpful, as Savannah just mentioned. We just had exactly that issue happening a couple weeks back in our region, and it was not a safe intervention whatsoever. So we need to make sure that folks at all levels of an organization know exactly what they're supposed to do and they're following that. And then of course, making sure that staff are making warm referrals to the right services in the region. A lot of the time that, in our region, that's going to come down to getting folks in touch with us in Northland, but it may not be us. It's just going to depend upon the very unique circumstances that that person's facing and what they want to do as well in that moment. So in it regard to that profession specific training I mentioned, we encourage all organizations in our region to get Fiat certified. Very easy. You essentially designate a point of contact. You let us train at least 75% of the organization staff and then integrate the training into new hire onboarding and annually let us retrain your staff once a year. And that is something that we very much customize to the exact organization that we're working with. So we did, for example, training with NACASA, and that was all for just specifically for SANE nurses. Right now, one big thing we're working on is as members of the continuum of care, making sure that all of our human services providers know exactly what to do and have very specific training with regard to the intersection between homelessness and trafficking. So again, has to be unique to what folks are doing in their day-to-day, and they have to see their ownership in being a solution to the problem as well. As part of FIA, of course, back in 2017, our community created flowcharts. So we do have these available, and we try to get folks to utilize them as much as possible. We did create one for adults as well as one for juveniles. The adult one, of course, has a lot more options for a variety of reasons, but essentially, we want folks to be referring to either us at Northland Family Help Center or to the Arizona Human Trafficking Hotline. Great thing about the Arizona Human Trafficking Hotline is they're able to actually talk to, if they don't want to make a law enforcement tip, they do not have to. They can talk to a survivor leader or a social worker by calling that hotline. And then, of course, us over at Northland, we're able to assist in that 24/7 capacity as well, providing emergency shelter for up to 90 days or longer, depending upon their circumstances, and making sure that they're getting connected with all of the services that they may need. Again, we're not necessarily looking for somebody to make a disclosure, but if we have reasonable reasons to believe that they have experienced some sort of exploitation or violence, we can at least make sure that their needs are met, right? And from there, whether or not they're going to make a disclosure or want to talk about their experiences, that's really up to them. But at minimum, what we want to do is make sure that we're meeting those needs so that they can, of course, get what they need. And then when it comes to juveniles, of course, much more simple, especially if we're mandatory reporters, we're always recommending that folks get in touch with DCS or law enforcement, calling 911 if it's an emergency. And we have other information on here regarding tips, which includes our local non-emergency line or the Arizona Human Trafficking Hotline. And again, if you're a mandatory reporter and you suspect that a juvenile's experienced exploitation, you do have to contact law enforcement or DCS. It's not an option.
Thank you, Michelle, for that. And I want to emphasize some of what Michelle was just saying is that oftentimes, and we've seen this with a lot of clients that we've been able to serve, and I've just seen this over the span of my career, is I can talk to somebody 100 times before they ever disclose that there was trafficking or exploitation in their background. Some of that is because of seeing themselves as somebody that was engaging in sex work or prostitution, and not recognizing the abuse that was happening. It can be from all of the sensationalized information that we have out there. But I've had clients that I've worked with for 3-4 months, where we've had deep conversations about trafficking and exploitation, working with them from a place of sexual abuse or homelessness, and then months later finding out that they had exploitation experiences in their background. Some of that is because the pieces that they are able to put together at different times of their journey, and that, or it could be because one scenario is shared and that makes sense to them, and that's really where they connect it. So when we're looking at prevention, we want to look at a public health framework, and that's what AJR really focuses on. We focus on primary prevention, which stops trafficking before it happens. Secondary prevention aims to identify and intervene, and then making sure that we're not having those trafficking experiences happen again. So once it's happened, how do we stop it from happening again? And how do we break those generational cycles of abuse? And this model really takes a whole community. So that's hospitals, schools, community-based organizations, and helping people understand the realities of trafficking within their area. And we're able to provide training and technical assistance to organizations to be able to integrate those identification and understandings of trafficking, and so that we can all be working on this as a community, because it's not just trafficking organizations or just trafficking prevention. All of these things are intersectional, and we need to be focusing on all aspects of that and really helping understand how trafficking is actually happening in the area that you are serving. Next slide. Harm reduction and safety planning is really putting people in the driver's seat of their own healing journey. And a lot of times when we talk about harm reduction, we talk about substance use, and harm reduction is really important for the recovery process, and it's meeting people where they're at and not expecting them to be checking off boxes of what it looks like, providing a lot of psychoeducation, safety planning, and understanding of trauma, exploitation, substance use, all of these things that are integrated into the lives of individuals having these experiences, to make sure that we're talking openly about stuff. Sexual health, mental health, all of these things are correlated, and the recovery process is long term. And there's all sorts of different modalities that work with different people. And we want to have an array of services and an array of opportunities for people to connect, to be able to support them. These kids are resilient and amazing and are able to do phenomenal things in their lives. And so what happens a lot of times when we're providing services is we find this kiddo that has had these horrible experiences, and we hyperfixate on that, and then we bring them into services, and we're like, okay, we need to like get you on this specific track within 6 months, and that way you're like back in school and you're going to prom and you're doing all of these normal things, which are not things that are important to kiddos anymore after having these experiences. Not to say that that can't happen, but we're not going to give them their innocence back. We're not going to get them back to square one. It's really meeting them where they're at and moving forward with all of these really amazing survival skills that they've already developed for themselves. Because if they are sitting in front of you and they have had these experiences, it's because they are amazing and badass and all of the things that they are. And they've gotten themselves to that point, and they can get themselves to their next points as well. And it's supporting them and listening to them. It means that if they tell you that they're not using substances, they could be lying, maybe, but also there might be other reasons that they're using, or that they actually aren't using. It could mean that they think that one of their people that they were connected with on the streets is a very safe person, and you might not think that that person's a safe person for them, but that's not our job to tell them who safe people are, because even within the culture of what they're experiencing, there's going to be certain people that are supportive for them that we might not see from an outside perspective as a supportive person. Okay, I can go on about that for hours, so we're going to move on before I talk that to death. We want to use a survivor-centered approach. This is survivor-centered in the sense of the person that's sitting in front of you, but also making sure that survivor-informed interventions, supports, and policies and procedures are all implemented into your organization, and that you're not going off of stats and all of these different things. We want to make sure that we're looking at things that actually really work for people and have worked for people. It means connecting youth and adults that have experienced trafficking with other people that have experienced trafficking for peer-to-peer, for that support. You know, one of the most effective things in my life was really connecting with a lot of people that had had these experiences. So I didn't have to put this mask on and feel like I had to like be somebody I'm not in order to get the services that I needed. And I could just really talk about the good and the bad and the positives and the negatives and not feel like I'm going to be judged for whatever that is. So it's important to have survivor-centered approach where we're putting people in the driver's seat of their own healing and recovery. And then also making sure that we're listening to people with lived experience to implement all of these policies and procedures, and that we're not an afterthought, that this is integrated from the forefront. Because often what we'll see is that survivors are brought in as consultants, and what that means is often you've already developed your curriculum, you've already developed your training, and then you're like, hey, can I get your stamp of approval on this? Instead of calling and being like, hey, we're doing this research project, or we're starting this curriculum. We'd really like to have you in at the beginning so that we're doing it right from the beginning, because what might look like a great long-term like intervention process we might see all the holes in that idea right from the beginning, or have different ways of knowing how to approach certain things from living on the streets and being in these situations and knowing the mentality of living in a group home and all of these things that will impact the service delivery that you're developing. So really quick, Applejacks Ranch has 3 programs right now that are funded through our grant, which is REACH. It's our Resiliency, Education, and Advocacy for Community Health. I'm a stickler for acronyms, if you can't tell. I love making them and think they're super cute. So REACH is our community-based education program. VIBES is our youth program, which is a voice and belonging, expression, and safety. And this is where youth meet with our prevention specialist and are able to connect to resources. We have an online school for credit recovery that we can connect them with, that they get a life coach with, and connect with our prevention specialist and make sure all of that's coordinated. And all of our curriculum and interventions that we work with is really focusing on belonging, expression, and safety in all aspects. That also focuses on our runaway program. So if a youth has any history of running away or sexual abuse, they can be at risk of trafficking or have experienced trafficking to be able to receive services through us. And then our parent pathways classes are healing-centered parenting classes, and those are parenting classes that are 16 weeks long. They can be done one-on-one or in a group setting, and that will be where we work with parents on a healing-centered approach to reintegration if their children have been involved in the system in any way, child welfare, juvenile justice, and all of those classes are led by people that have either been system involved themselves as children or have been parents with that have had system involvement as well. And we are hoping to grow that large and wide across the state. So those are some of the services that we provide at AJR. And if you have any questions or any anything that you need just to like even review something like, hey, I have this youth that I'm working with, I'm not sure what's going on, and you need to talk to somebody about it, you can call us and we can help support you in maybe navigating some of that stuff. And we also have because of what we're doing in the rural community, we do have a lot of opportunities to work with people remotely, even if they're not inside Yavapai County. And we're coordinating different care. And we want to try to avoid youth being removed and sent down to Phoenix, and make sure that we're coordinating care between all of the organizations up here so that we can mitigate that risk factor. Also, we offer free monthly trainings through our REACH program that you can sign up on our website at applejacksranch.org. Those trainings are going to be, they happen monthly. They're a deep dive into trafficking and exploitation and different trauma topics, like specifically unhoused and trafficking, moral injury, healing-centered approaches, and all of those are from a lived experience perspective. I'm really proud to say that everybody at AJR it has lived experience, and it's one of the greatest things I've been able to accomplish in my life is to build this organization from the ground up with people, with myself and other people with lived experience at the forefront, and it makes my whole heart happy. So that's our whole goal, is to help with those pieces and get those trainings out to you guys, and then also provide services that are focused on prevention and intervention and building transformational relationships.
Questions?
I encourage everyone to take a picture of this slide, and before I go further, is this a slide presentation something that you can provide me that I can email out to everyone?
I can.
I'm good with that, yeah. And then I realized we forgot to put Savannah's contact information on here. So if you do reach out to me, I'll just get you over to Savannah.
Or Savannah can put her contact
I
information
can put it in the chat.
That too. That's smarter.
Okay.
Thank you, Lori.
We did start 10 minutes late, so I'm hoping people can stay on another 10 minutes past the 11:30 time. I think we do have questions. George, I see your hand up.
Yes, thank you. Thank you for a very thought-provoking presentation and for the work that you do. My question is related to a statewide occurrence of the sex and labor trafficking. My thoughts being, if you could take the roughly 14,000 youth who are in foster homes and then multiply that by the percent of youth who have a high ACE score, and then take that number and multiply by 20% for women, or excuse me, men, and 80% for women, we might have an idea of the statewide size of the problem. Thank you very much.
Any other questions or comments? This is your opportunity. You've got the experts here. I see in the chat, Amy said Lindsay Ploss at Community Health Services of Yavapai County has some great relationships with schools as well. I think the training that your grant funding is something that needs to be refreshed, renewed, expanded. So always like to put that out there for folks. What about the relationships with behavioral health homes? And trainings for their staff and the kids team or the adults. I think the schools are extremely important. But what can you say about the relationship with the behavioral health system?
Specifically for us, I don't know where you're at with this, Michelle, but this is really what, so we got the grant. So we got the grant in October, which is what has allowed us to start implementing these trainings. We are able to, and I believe this is the same for Fiat in a lot of ways, is we are able to provide these trainings for free to anybody. And I think for us as an organization, what's most important right now is just making those connections and connecting with those organizations so that they know that we could provide those free trainings and technical assistance to them. And that is a really important population that we need to continue to connect with. And another thing that's really important for me is helping train therapists that are working with youth with trauma, specifically around aspects of trafficking and exploitation, to help integrate that into the long-term and the long-term care of youth. We don't have a lot of trafficking specific therapists, and there are aspects of trafficking that therapists need to be very aware of and understanding to be able to work with that population. And we're more than happy to provide that training and support and connect them to resources. Yeah, so we're here to work with anybody and everybody, and we're able to do that through the grant. So if you have people that you want us to connect with, that you want us to be able to provide those trainings for, I love human beings and community and relationships. So that's what that our whole focus is, not just on transformational relationships with our clients, but also with the community. And we want to be deeply integrated into that and supporting everybody who already exists here.
Excellent, excellent. Thank you. Any other questions or comments? Anyone from a behavioral health background or the justice system?
So, hi, Lori, it's Heidi. I did have one of our human trafficking detectives on earlier. He had to jump off because they're very, very busy. And I got the chance to kind of ask him, hey, and compared to some of the stats that we just saw, is there anything that I can share to the group? And we were, Yavapai County Sheriff's Office got a grant for 2 human trafficking detectives just last fall. So they have only been hitting the grounds for like probably about 6 months. So he didn't have any substantial stats to share, as Michelle mentioned. They're limited anyway. But he did say the trend that he has seen in our area is many of the victims that they have found so far are chronic runaways, so juveniles and with troubled home life or no home at all. And then they also have little to no parental involvement, mixed with an unabated access to social media. So that's what he could give me there. And then I asked how they have found some of these victims. And he said it's kind of a healthy mix of anonymous tips, sting operations, and most recently, he said more and more we are getting tips from our detention officers and our patrol deputies, because we've been really focusing on training our deputies to be aware of signs. And so more and more our deputies and detention officers are bringing the attention to a call where things might seem a little askew. And so we've gotten some that way too.
Thank you so much, Heidi, for sharing that. I really appreciate it. And it does, and it's such a good insight into what's happening and what we're seeing. And it's the same for all of us across the board. Runaway and homeless youth are going to be our highest risk factors all the time. And one of the things that you touched on that I just lost my train of thought on, I was just going to say something to it and now I forgot.
Social media?
Parental involvement. So that's another reason that we have the parenting classes too, is because we often see once youth are involved in the system in any way, juvenile justice or child welfare, we really want to start those prevention pieces with the parents ahead of time. And a big part of that is helping parents break their own generational cycles of abuse so that they can show up for their kids, because the parental involvement is such a huge piece in this. And kids really want this information from their parents in a lot of ways. And then there's also the aspects of abuse. But what we also see, and one of the things that we're focused on in our long-term goals, is mitigating the risk factors that lead youth to being engaged in juvenile detention and child welfare from the forefront, by helping parents that might have their children removed for neglect reasons and they're non-offending parents. So how do we mitigate those risk factors of neglect if it's associated with poverty and that kind of stuff? And then also, again, really taking that approach of addressing the trauma and understanding those things so that that abuse is not reoccurring. And so that we're breaking those generational cycles and being able to work directly with parents in reintegration with their kids and helping them to have those conversations with their kids.
All right, thank you. And Savannah, if you want to stop the screen share, then we can see who's still here. Thank you. Any other questions or comments? All right, well, on behalf of NAMI Yavapai and the Arizona Peer and Family Coalition and Northern Arizona Peer and Family Coalition, thank you, Savannah and Michelle, so much for the work that you're doing, for taking the time to join us and be the presenters for Mental Health Monday today on Tuesday. And everyone who has participated, thank you for your patience in navigating our delay of getting started due to technical difficulties. I'd like to make just a couple of announcements. Next month, our Mental Health Monday is on a Monday, June 24th. Our topic is going to be peer support in the justice system. And we're going to have leadership from within the county jail system and peer and family service agencies on a panel. So this will be a good discussion. Our next Northern Arizona Peer and Family Coalition meeting is Wednesday, June 19th at 1 p.m. We meet the third Wednesday of each month. And if you'd like to see this recording, you will be able to find it on the NAMI Yavapai YouTube channel. And I think that with that said, I just